bunch of medical students present in a community, the community's health is going to improve by their very presence.
Yakima is considered an underserved community, and so having the school here and creating primary care physicians I think is really important, because you can incorporate the medical aspect from the school into a community who really needs it.
The community is the patient. And in that way, we say here at Pacific Northwest University of Health Sciences that where people are healthy, communities thrive. So too, when communities are healthy, people thrive. And the laboratory for the students to learn about community thriving is all around us. Right here in Yakima County are evident some of the very same difficulties that nations in sub-Saharan Africa struggle with on a daily basis. For health outcomes, Yakima County ranks 35 out of 39 counties in the state of Washington. The three main epidemics are the obesity, diabetes, and violence. Under health factors, it includes children living in poverty, children living in single-parent households, and high school graduation rates. PNWU was clearly a response to these critical and unmet health needs, and the difficulty that the health system was having here in Central Washington for retaining health professionals.
Osteopathic medicine is an incorporation of the mind, body, and spirit in medical practice, as well as osteopathic manipulative medicine.
In colleges of osteopathic medicine, we recognize that the body is a unit, that the body is a self-healing organism, that structure and function are interrelated, and that the health professional treats with these tenets in mind.
As a student, you can go out into the community and see where people are living, how they're living, what their day-to-day life is like. It gives you a fuller perspective of when you see somebody in the clinic.
The role of service learning places the students directly in the community. The students in these early clinical experiences are provided extraordinary opportunities to test not only their academic knowledge, but also their skills as change agents.
Early clinical experiences is a project to bring first-year medical students to observe with a provider.
My name is Carlos Emmanuel Vargas. I'm originally from Pharr, Texas, which is about 5 miles away from the U.S.-Mexico border. My ECE, early clinical experience at Toppenish Hospital, was everything I was hoping for. One patient didn't have trust in the medical system anymore, and he was kind of relieved to see that we're compassionate, caring doctors, and he was glad that Dr. Ramos-Diaz was training us, in essence, to become and follow her steps.
I say to my students, you got to know the language, you got to know the people, to have someone that they look into their eyes and say, oh, that's who I'm supposed to be serving. What they were doing in the textbooks, it brought to life in a patient.
Hi, how are you doing? I'm Shireen Fazal Hashimi. I'm a second-year medical student at Pacific Northwest University, and I really wanted to come to this school because when I became interested in medicine, I wanted to be a primary care doctor who helps underserved communities. My first semester in medical school, I started to volunteer at the Union Gospel Mission. The Union Gospel Mission has a medical and dental clinic as well as housing for underserved communities in Yakima. Here at the clinic, we serve about 12,000 patients a year. Go ahead and take a deep breath. It kind of reinforces why I came to medical school, and it gives me hope that one day it'll actually be my everyday life.
When they're there, then they realize, oh, this is why I have the passion to become a physician, which is to heal.
Out of the community health assessment that Memorial Hospital performed locally, it was evident that infants were dying faster in the Native American community. So with that came the opportunity to see where a response was already arriving through the work of Polly Olson and Jessica Sutterlicht with the Indigenous Wellness Research Institute and the University of Washington School of Public Health.
I'm Polly Rigdon Olson, member of Yakima Nation. Our work with Pacific Northwest University is to provide access for Native American students attending that school to have access to cultural projects. I currently am a co-lead to the ttawaxt project on the Yakima Reservation, looking at infant mortality rates and building a stronger relationship between the healthcare systems in Yakima Valley and the tribe. Ttawaxt means healthy families. We will be doing quantitative and qualitative research, and so that we can also share that information through oral history, storytelling to our younger people as educational tools so that they can take care of their babies. Those babies are our future.
I am doing everything I am for my family and for myself and my future and for my kids and for everybody in my community. Ever since I can remember, my father has worked in the fields. My parents would put me into a bin and I would watch them pick asparagus, peaches. We've picked everything that pretty much Yakima grows. To attend PNWU as a high school student was very interesting. I felt welcomed and I felt like people really cared about you individually. It really helped me discover what it means to be a doctor. I enjoy being a part of my community. I enjoy being a part of people's lives and helping them. And if becoming a doctor is one of the ways that I can do it, then I will definitely want to become a doctor.
It requires an entire community to care for itself, to value itself, to feel valued and to be valued.
Now you see the joy that the PNWU students bring, that in itself makes a community thrive.
When people are healthy, communities do thrive because healthy people are able to contribute to society and their community in a positive, progressive way.
When people are healthy, communities thrive.
Cuando la gente es sana, comunidades prosperan.
وقتی آدما سالم هستن، اجتماع بهتره.
When people are healthy, communities thrive.